Nicholson. I'm the lead social worker here at Pascack Valley Medical Center, and I want to talk to you today about managing stress and anxiety during the pandemic. Managing stress and anxiety during the pandemic has been a challenge for everyone, especially people who are dealing with a chronic medical condition. While we see a positive stride being made in the approval and rollout of the vaccine, we're still dealing with the realities of living in this pandemic. So what are some of our experiences during the pandemic? What are causing our stress, depression, and anxiety? Fear and uncertainty. We're feeling more vulnerable and more at risk. How do I see my doctor? How can I still get the care that I need? Can I go to the emergency room? How do I stay safe? Maybe feelings of isolation. You're unable to see your family, your friends, and you have your normal everyday interactions. Anger and frustration, especially with restrictions, wearing masks, and maybe with others not adhering to these restrictions or wearing the masks. Boredom. Your routine has changed. Your home, there's only so many Netflix things you can watch before it gets a little old. Change in routine or having little or no routine. You're used to getting up, going to work, going to an exercise program, just running errands. These things are important for our everyday life. Feeling overwhelmed. What's going on in the world? We went through a major election. We went through this major medical episode, and there's a lot of information coming at us all at once, and it can be very overwhelming, and especially feeling a very strong lack of control. When you're feeling that you can't make a difference, nothing you're doing is changing the situation, it can be very unnerving and very frustrating. So I've mentioned a few times about stress. What are we talking about when we say stress? Stress is a feeling of emotional or physical tension. It can come from any event or thought that makes you feel frustrated, angry, or nervous. It's your body's reaction to a challenge or demand. In short bursts, stress can be very positive, such as when it helps you avoid danger or meet a deadline. And it's good if it motivates you, but it's bad if it wears you down. As previously mentioned, many factors contribute to the stress you experience, and it can cause changes in your body that affect your overall physical, mental, and emotional health. So what are some common signs of stress? You may have trouble sleeping, you may feel overwhelmed, and maybe have problems with your memory or concentrating. There could be a change in your eating habits, which means you could be eating too little or too much. You might feel nervous or anxious, angry, irritable, or easily frustrated. You could be burned out from studying, schoolwork, your job, or the kids. Maybe you're feeling that you can't overcome your difficulties in your life, and you might have trouble functioning in work or in your personal life. Earlier I mentioned anxiety. What is anxiety, and how does that differ from stress? Anxiety is an emotion characterized by feelings of tension, worried thoughts, and usually includes feelings of apprehension, uncertainty, or fear, as well as negative thinking. It can cause physical symptoms like increased blood pressure and rapid heart rate. Other symptoms can also include sweating or dry mouth, hot flashes, heart palpitations, muscle tensions, or restlessness. Something else you might be experiencing during this time is depression. And depression isn't just sadness. Most people feel sad or depressed at times. It's a normal reaction to loss or life's challenges. But when intense sadness, including feelings of hopelessness, helplessness, and worthlessness, lasts for many days to weeks and keeps you from living your life, it may be something more than sadness. There are some common signs of depression that you should be aware of. Withdrawing from other people, feeling sad and hopeless. You may have a lack of energy or enthusiasm or motivation. You could have trouble making decisions, maybe feeling restless and agitated, irritable. You could eat more or less. Maybe you're sleeping more or less. You could be having trouble concentrating or with memory. It's also not uncommon for people who are suffering from depression to have physical symptoms. Back and joint pain are common, digestive problems, sleep trouble, and appetite changes. You might even have slowed speech and movements. There are coping strategies and ways to manage stress that you can do. First, acknowledge your feelings to yourself and maybe others, and recognize that your fears, concerns, or stress are normal and valid. Stay informed, but not over-informed. Limit your time watching TV, the media, and staying on social media. If it is compounding your worries, it's okay to tune out. Continue with your hobbies and projects, or start new ones, but don't put undue pressure on yourself. Do what you like. Try to maintain your routine as much as possible. If you work from home, get up at the same time every day and get dressed like you're going to the office. If you can't get to the gym or work out like you normally do, improvise. Use the stairs in your house. Change up your exercises or go for long walks. Go out and run your errands. If you can't go in, maybe get curbside pickup or do drive-through. Pay attention to your food and alcohol intake. Unwanted weight gain and negative effects of alcohol consumption can increase your feelings of anxiety and depression. Try journaling or deep breathing exercises, guided meditation and imagery. And also, tell yourself that what you're feeling is okay. While it's normal to experience anxiety and depression during times like this, it's important to understand when you need to seek additional support. Most people feel sad and depressed, experience anxiety or stress at times, and that's a normal reaction to loss or life's challenges. But when intense symptoms and feelings occur, including feeling helpless, hopeless, or worthless, which last for many days or weeks, they keep you from living your life, is disruptive, and causes discomfort, and maybe something more. Please reach out to your primary care physician, mental health hotline, or go to your nearest emergency department. Again, my name is Carrie Olson. I'm the lead social worker at Pascack Valley Medical Center. Thank you for joining me on this presentation. I hope you found it informative and helpful.